Good morning, my name is Anne. I'm the founder of Coaching Coins. And today I want to talk about pharmacy career, and this will be more targeted for those interested in pursuing pharmacy as a career, as well as for those parents who may want to know more information for your kids in high school or college. So let's get started. Usually I get invited to high school or other college functions to talk about pharmacy. So I get asked a lot of similar questions, so I thought, why not make a video out of it so others can benefit as well. So I will look at my screen for some of the questions that students tend to ask, and I'll do my best to share my insights. Again, this is my perspective and insight alone. Other pharmacists may have other opinions, so feel free to continue asking and shadowing pharmacists first of all. Okay, so let's get started. These are FAQ questions that students tend to ask me, so I'm gonna read them off and answer them. What undergrad major do you recommend when you're pursuing pharmacy? In pharmacy, actually, now that we generally don't require a bachelor, but now it's highly recommended because it's very competitive. With pharmacy school, they're usually, if you do 2 years of prerequisites, or 3 depending how long it would take you to do classes, and then you apply to pharmacy school, and based on your PCAT score and also just overall relevant experiences that you have, and of course the prerequisites, they will look at that. So every pharmacy school is very different in terms of prerequisites that they require. A lot of them are similar, but some are different. So what I would recommend is that depending on which school you decide to apply to, look at what they require, because some would require 2-year organic chemistry, 2 year of calculus, but some would only require 1 year of organic chemistry. So, or one would require like history or other elective that you may not think about. So depending on, again, which one you prefer to go, I would highly recommend look at the site before you even start your prerequisites, because unlike medical school, which may also have different requirements for their prerequisites, pharmacy school will have even more diverse, especially if you think about out of state or in state. So with that being said, what undergrad major do you recommend? This one, I would say follow the ones that you're passionate about and that you're good at. So if you're not super interested in chemistry, but you're more biology person, go for biology. But of course, all the prerequisites you have to fulfill. Or if you're very interested in business, but you're able to take science courses and other courses to fulfill the prerequisites, go and do business and psychology. So I don't think there's particular major that will help or hurt you. Well, it will help you further if you get like a biology or like a science degree, because in those coursework, you have a lot of science courses that will help you in pharmacy. The first 2 year pharmacy school are very foundational, meaning that a lot of them cover science courses because they want to get all the students to the same level. As you can see that they have students from all over the country or sometimes over the world, and they have to get the students to like a basic foundational. So the first 2 years is on pharmacology, biochemistry, anatomy and physiology. So if you are a chemistry or biology major, likely the chance of you cruising through or like get to be very proficient at those courses the first 2 years are very high compared to someone who's arts major and may not have as many exposure to science courses besides the prerequisites. So it just depends, but my recommendation, pursue what you're interested in and what you're good at. How long does it take on average to complete pharmacy school? So pharmacy school is 4 years for the most part. There are some pharmacy school out there that actually have a combined pre-pharmacy and pharmacy that will be 6 years. For now, in terms of professional degree, if you do your prerequisites separately, then it would be 4 years. What are the differences in responsible pharmacists in retail setting versus a hospital setting? I won't go into much detail on this for this video, but in terms of the workflow and also the types of practice that you do and the types of work, in retail setting, you actually gonna have more patient-to-patient contacts because the patients are there. In the hospital settings, you will also have direct patient care depending on your role. So if you're a clinical pharmacist on the floor with the nurses and providers, then you have more direct patient care versus if you are more of a staffing role in the pharmacy operations, then you still going to have patient care responsibilities, but you may not see like patient directly. So I know I kept that pretty vague because I think once you get into the world itself, you probably know more, and I would highly recommend that you shadow a pharmacist if you're interested in that. What is the average work-life balance of a pharmacist? This is always a really hard question for me to answer because it really depends on your job and your role. Not all pharmacists have 9-to-5 jobs. Actually, mostly in retail or even hospital settings, pharmacists have to work holidays, late hours, especially in hospital. It's a 24/7 service. So you have pharmacists that work night shift, or we call the graveyard shift, usually 7 p.m. to 7 a.m. It may fluctuate a little bit. So it really depends. In terms of work-life balance, for those that have more of hourly commitment, you work and then that's it, you go home. If you're more clinical pharmacist in the hospital or managerial, where you may be on call when you go home, so and then you may be rotated with others, so it's not like you have to do it every day. And it also depends on like the hospital that you work at. So, and most importantly, it depends on you. Are you able to manage your work at work effectively and efficiently so you don't have to take work home? Unfortunately for me, you know, there are times where you do have to take work home just because the sheer responsibility when you're a clinical pharmacist, because you have a presentation, a big presentation tomorrow, or if you are a manager or a director of pharmacy that you have to present on certain things or have a big meeting that you have to prepare for. So it really depends, but I think most importantly is the person and how you handle the workload and how you able to delegate certain work. So that is very, I know it's very vague, but I think every pharmacist has a different ways of strategizing and prioritizing their task. Why did you want to become a pharmacist? The reason that I want to become a pharmacist is because I felt like it was something, I actually was in between being a medical doctor or a pharmacist. And like in your shoes, I looked around, I researched, I talked to people, and most importantly, I think what really further guided me towards pharmacies, I start shadowing a pharmacist in the hospital as well as in retail, and also getting a job like in the retail side that will help you tremendously because you get to kind of know the workflow. You can only talk to people or shadow them so much that you understand, but until you actually work in that environment, you feel like it's the right fit for me. So being a pharmacist, where I worked at retail side, similar like H-E-B or Walgreens or CVS, I felt like you're the last step where before the patient take the medications, and you get to empower them and help them to get better. And then in the hospital settings, you work collaboratively with like nurses and healthcare providers to ensure that patient get the medication, the right therapy. So I feel like that's very valuable and also very rewarding to see that the patient you took care of got better and went home with their family. And so that's one of the reasons why I decided to pursue pharmacy. Last question for the day. What types of activities, academic or extracurricular, do you suggest that we do to better your chances of getting to pharmacy school? What I usually tell students is that, or those that are interested in pharmacy, is to consider be a well-rounded individual. What does that mean? That's so fake, right? So really, we look at your grade, we look at your academic performance, but we also want to know if you're doing anything else outside of school. Do you work? Do you volunteer? Do you take leadership roles? Do you take on initiatives and projects to show that you are engaging in the community? So, and then of course, once you pass through the application process, the interview, you're basically halfway in. So your communication skills, your leadership skills, you know, and I would say, and again, this is my personal opinion, is that I would take someone in who may have an average GPA, but also a great communicator, a great community leader, and just overall able to show commitment in other areas of their life versus a 4.0 GPA who may not have all those experiences, who may not pursue any of other extracurricular events. So it just really depends, but I think the more things you're able to get engaged and involved, the better. With caution is that you want to be committed. So you want to show that you're committed to an organization or a role. So don't try to participate in all different clubs and societies in college or in high school. Be selective and prioritize your commitment. Like let's say maybe just 2 organizations, but you're a vice president or secretary, or you're an active committee member or committee chair. That speaks more volume than just a member in 8 or 10 different organizations. Well, that's a wrap for today. I hope that was helpful. I will continue to do several of these videos for those in terms of who are interested in pharmacy and what to do to get yourself in pharmacy school. Thank you and have a great day. For those who are new, please subscribe to my channel and share widely. Thanks.